Welcome to The Explainer. Okay, let's dive into this, because today we're looking at an idea that completely shatters how we think about modern healthcare. Look, we all know the system is breaking down, right? But what if throwing more money or more screens at it isn't the fix? What if the solution is entirely structural? Well, let's unpack Professor Marcenes Health Capital, or HC framework. This white paper lays out a massive, structural case for transitioning both public and insurance-based health systems into an entirely new paradigm. It's really about bringing the humanity back to healthcare and, the actual economics of how we make that happen.
So here's our roadmap for today's explainer. First, we'll look at the current medical paradigm. Then, enter the Marcenes model. Third, redesigning healthcare resources. Fourth, healing the burnt-out doctor. And finally, a win for everyone. We're going to diagnose the current system's failures before proving exactly how this new model benefits every single stakeholder.
All right, part one, the current medical paradigm, where modern medicine lost its way.
Before we can even look at the solution, we've got to diagnose the disease within our current setup. So why has modern medicine lost its soul? Honestly, if you've interacted with the healthcare system recently, you've probably felt it firsthand. There's this deep patient frustration and a really profound sense of systemic alienation. Our current model is kind of failing by design. It feels cold, it feels mechanical, and it's highly medicalized. We're spending more and more money, sure, but the actual experience of receiving care and, frankly, the experience of giving care feels increasingly disconnected from actual human well-being.
Now, what's really interesting about this slide is the stark contrast in our current reality. On one side, as the source text outlines, doctors have been alienated. They're basically forced to act as abstract data terminals, or they're perceived as mercantilists, treating patients like commodities just to meet billing quotas. It's a purely transactional relationship. But contrast that with the historical ideal on the other side, doctors as valued partners and trusted community family healers. We've completely lost that community anchor, and honestly, both patients and doctors are paying a huge price for it.
Which brings us to part two, enter the Marcenes model, a paradigm shift in healthcare. You see, this model isn't just some minor policy tweak or a tiny adjustment to billing codes. It's a fundamental paradigm shift. The Health Capital, or HC framework, says that instead of immediately jumping to expensive, high-tech medicalization to solve every single problem, we absolutely must prioritize psychosocial determinants. What does that mean? Well, simply put, it means looking at how our social lives and our environments physically impact our minds and bodies. It brings relational care and community embedding right to the forefront. It's about looking at a patient not just as a collection of symptoms to be zapped with expensive tech, but as a real human being living within a social context.
And this brilliantly illustrates one of the most fascinating concepts in the white paper: zero-cost interventions. How do we actually address the universality of healthcare without totally bankrupting the system? Well, the Marcenes model argues that we can leverage the biological power of positive emotional states and social capital, which, really just means our community trust and support networks, to buffer health adversity. Because these interventions rely on human connection and localized support, they don't carry those prohibitive material costs of high-tech interventions. You're literally using the power of a healthy community and relational care to prevent and manage illness. It's a total game changer.
Let's move to and see how this builds into part three, redesigning healthcare resources, reallocating capital for better outcomes.
So we've talked about the philosophy. Now let's look at the money and the actual macro-level policy mechanics. If we look at how capital is allocated right now, the current model just wastes billions. It's heavily weighted toward bloated tertiary procedures and massive administrative bloat. The whole system is incredibly top-heavy and inefficient. But the Marcenes HC model demands a direct reallocation of those resources. It channels every single dollar away from that administrative bloat and pours it directly into robust primary healthcare, or PHC, and localized community infrastructure. It's really about moving the money to the front lines where those relationships actually happen, trading macro-level inefficiency for localized efficiency.
And this right here is the core financial engine of the framework. By intentionally moving away from expensive, high-tech medicalization as the default answer, systems free up the necessary capital to fund true primary healthcare. This reallocation is exactly what makes those powerful, zero-cost psychosocial interventions possible on a massive scale. You're actually funding the foundation of health, rather than just expensively reacting to a disease once it's already severe.
All right, part four, healing the burnt-out doctor, rebuilding trust and human connection.
So this framework doesn't just focus on the patient. It deeply addresses the crisis of the medical professionals who are stuck working inside the machine. The Marcenes model completely overturns the modern alienation that physicians face today. Remember earlier when we talked about doctors feeling like abstract data terminals? Well, by structurally embedding doctors back into their local communities, they regain something absolutely critical: deep insight into actual disease etiologies. When a doctor actually knows the community, they understand the root causes of their patients' illnesses, the social and environmental factors in a way that a transactional, quota-driven system simply doesn't allow.
The white paper uses a really powerful economic metaphor here. It frames chronic stress and burnout as a depreciation of a doctor's health capital. The current system depreciates our healers, just grinding them down day by day. But by adopting relational, community-centered care, this model actively halts that depreciation. It allows doctors to rebuild their reputation of trust and restores their status as valued partners in community health. This restoration is framed as a vital investment in the doctors themselves, prioritizing their humanity just as much as the patients.
Finally, Part 5, a win for everyone, the cascading benefits of the Marcenes framework.
Because when you fix the structural foundation, shifting away from the old model is absolutely not a zero-sum game. Just think about this breakdown. The advantages of the HC model over our current setup are staggering. Let's look at the stakeholders. Under the old model, doctors burn out and leave the profession. But here, under the Marcenes model, they are happier because they get to feel altruistic again. They actually get to heal. Under the old model, patients feel like numbers on a spreadsheet. But here, they are treated in a warmer, much more human environment. Governments are currently drowning in healthcare debt, but the HC model fixes chronic system problems without endless spending. And finally, even the insurers win, because funding proactive primary care is drastically cheaper than funding reactive, bloated tertiary surgeries. Every single stakeholder benefits. It's just a massive win for everyone.
So the crucial point is captured beautifully in this quote from the source. Patients will be happier with a warmer health environment and will return it to doctors. I mean, this perfectly illustrates the reciprocal nature of health capital. Healing isn't just some one-way street of dispensing medication. It's a relational ecosystem. When the system allows for a warmer environment, it quite literally heals the healer just as much as the patient.
We've really seen how the Marcenes Health Capital model outshines the current medical paradigm at every single turn. It addresses universality through zero-cost interventions, it reallocates resources away from all that administrative bloat, and it restores doctors to their rightful place right in the heart of the community. It's that rare solution that genuinely benefits patients, doctors, governments, and insurers alike. So I'll leave you with this to think about. How quickly could your community restore the soul of medicine if it adopted this framework today? Thank you so much for joining me for this explainer, and keep questioning the systems around you.